Sciatica refers to pain that radiates along the path of the sciatic nerve, which branches from your lower back through your hips and buttocks and down each leg. Typically, sciatica affects only one side of your body. The pain can range from mild to severe and is often caused by a herniated disc, bone spur on the spine, or narrowing of the spine, spinal stenosis, compressing part of the nerve. Problems associated with sciatica. 1. Neck pain. The most common symptom is a sharp, burning, or shooting pain that extends from the lower back through the buttock and down the leg. It can vary from mild discomfort to severe, debilitating pain. 2. Numbness and tingling. Sciatica can cause a pins and needles sensation, tingling, or numbness along the nerve pathway in the leg or foot. 3. Muscle weakness. The affected leg or foot may feel weak, making it difficult to move or control. 4. Difficulty in movement. Sciatica can make it challenging to stand up, sit down, walk, or perform other movements. 5. Chronic pain. If left untreated, sciatica can lead to chronic pain and long-term discomfort. Problem-solving methods. 1. Physical therapy. Exercises to strengthen the muscles of the back, abdomen, and legs can help relieve sciatica. Physical therapists design specific exercise programs to improve flexibility and strength, which can alleviate pressure on the sciatic nerve. Reference: American Physical Therapy Association, https /www.apta.org/. 2. Medications. Over-the-counter pain relievers, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, can help reduce pain and inflammation. Prescription medications, muscle relaxants, anti-seizure medications, and tricyclic antidepressants might be prescribed for more severe pain. Reference: National Institute of Neurological Disorders and Stroke, https
Steroid injections.
Corticosteroid injections can reduce inflammation around the irritated nerve and provide temporary pain relief. However, they are not a long-term solution and are usually limited to a few injections a year. Reference: Mayo Clinic, https /www.mayoclinic.org. 4. Alternative therapies. Acupuncture. Some people find relief through acupuncture, which involves inserting fine needles into specific points on the body. Chiropractic care, spinal adjustments and manipulations performed by a chiropractor can help relieve sciatica pain for some people. Reference: National Center for Complementary and Integrative Health, https /nci.nih.gov/. 5. Lifestyle modifications. Ergonomic adjustments. Improving posture and using ergonomic furniture can reduce strain on the lower back. Weight management. Maintaining a healthy weight can reduce pressure on the spine and sciatic nerve. Exercise and stretching. Regular exercise and stretching, especially exercises targeting the core muscles, can help prevent sciatica. Reference: Harvard Health Publishing, https /www.health.harvard.edu/. 6. Surgery. In severe cases where conservative treatments fail, surgery may be required. Procedures like a microdiscectomy or laminectomy can remove the part of the disc or bone spur pressing on the nerve. Reference: American Academy of Orthopedic Surgeons, https /www.aos.org/. Conclusion: Sciatica is a common condition that can significantly affect quality of life. Understanding the causes and symptoms is crucial for effective treatment. A combination of physical therapy, medication, lifestyle changes, and sometimes surgical intervention can help manage and alleviate sciatica pain. For a comprehensive approach to managing sciatica, always consult with healthcare professionals to tailor treatments to individual needs and conditions.